medical facility and then home care, the same. Okay. The case study, the page 19 page, the case study in the each round list. I have some infection the last week, and some bite the bug and the ant or something. I'm try to myself hygiene, and I make the cream. There's some the allergy, so I talk to doctor. The facility. They give me the virus the medicine, and also they give to me cortisol the cream. They gave to me, but over 7 days, week, but little this and again. So I try to contact the specialist. Yeah, but they give to me the new medicine, the work. So more improved. So this is here, the 19. Yeah, sometimes you have some the issue, the skin or the dengue virus. So especially this season, the summertime we are outside the picnic or the world or the wide world, right? So many things have the problem. So you have to prevent the patch or the spray or more hygiene. It's much better. Okay. Okay. So page 20. When they greet each other by the saying, "How are you today?" Is normally we are greeting, right? But how are you doing? But especially, it's my clinic. Why are you coming? It's my clinic. No, right? How are you today? The nonsense, because the patient coming to my clinic because they have some issue that the personality, the symptom or the vital sign or something disorder, the mood, so they just coming. So we have to ask them, how's it feel today, right? But I ask you, how are you today, right? Because you're a classmate, you are healthy people. So usually my patient coming, my clinic,
how can I help you?
Yeah, how can I help you? Or how do you feel? Is it much better than last week? How are your symptoms? How's the pain level, assignment or something? So the different dialogues, yeah. So I want to try to this semester. Why is the monitoring is very important? The facility and or home the scanning too, because everybody wants a healthy life, the ultimate health. But problem we don't know. We don't know so what's going on. Yeah, because I have the two kind of the skin problem. One is by they call me the single, and then the other the skin problem is the virus from the birth too. So the different the medicine, and we have to cure the different way, but it's not same medicine, right? So it's very important here. So because you don't want the side effect anything, the disease or the medication. So this time I'm figure out sometimes we have one body, but sometimes two kind of symptom, the vital sign. We have to be careful to approach the cure. So with the monitoring, very important. Okay, Tina, you have to try to link, please.
We are expecting interest in the commonplace ups and downs that we are experiencing. Factors such as weather, last night's sleep, how much or what we had to eat, whether today's events are tedious or exciting, and our interaction with family and colleagues all help determine how good we feel each day. You are likely to feel on top of the world only if your physical health is good. Keeping your body in good shape requires that you establish healthy habits, including well-balanced diet, regular exercise, control and avoidance of stress to the extent possible. Some people use middle age as a reason to abandon any attempt to stay in shape. If you are healthy, there is little excuse for not being in good physical condition.
Okay, so our body in addition to the inner system, or outside the system. The last week with the demonstration, the picture, right? The inside the body and the screen, and then the other the demonstration and the screen first, and then second the body. Because the first of the picture, then we have the immune system, right? So we have organ, the cell, the water, the nutrition side, the cell, the water, the CO2, oxygen, everything here. So all surrounding by the skin. So the protect some, attract some outside some the germ. But the second picture, we already allowed some infection, the virus or car accident or injury. There are some the stress problem, and then the stress for the outside, right? But inside the stress, the personality. But sometimes we have the relationship, or some the too much overwork, or the jam in the traffic. So they're outside the stress. So the between. So we have optimal health. So we have to maintenance because there are so many issues this year, right? And also 4 years ago we have the strange virus, right? The COVID-19. So we're more common the virus and the change virus too. So we don't know. We just normal life, but sometimes the special issue. So we have the protect the myself. Okay, keep going.
In this chapter, we explain how to access your heart, lungs, and muscle to find out just how physically fit you are. Your health is also closely linked with your diet. The fiber of a wide variety of nutritious food is one of the main reasons people today live longer.
Okay, so live longer. The longest they have, we have 2 points. We have the stem cell, right?
Mm-hmm.
Telemon, right?
Telemon.
Yeah, right? The telemon, the DNA, the tail here, telomere. So you have a long telomere, will longer stay. Little short is more, shorter the longer stay, yeah. And also DNA, the activity, and the nutrition, the core, the brain, brain, the function. So I want to contact this one, the brain pop, and migraine, because the brain pop, today is a very sunshine, right? But this morning, little rain, just from my town, and the cloud, to me, the brain pop, the cloud, your heart, because we're happy, the energy fill up, and my condition good, it's no cloud, right? Sometimes mood the disorder, and some of the stress, and then depression, the cloud, right? So now they eventually have the brain, the mental, the focus. They have so many people to try to the healthy maintenance of the brain. So the dementia, because the dementia, the Parkinson, and the panic, the depression, there's so many issues, the mental disorder. So they want to try to. But before 10 years ago, they worry about the cancer. Yeah, almost 80% they worry about the cancer, the condition. But now they need to change because of the brain. Yeah. The brain, the memory support. You have to shape the memory here. The Dina, why does people have the little memory loss? Why?
Some time of the disease, some time of the maybe they get an accident and then have the lower function of the memory. But sometimes that people are not active enough, like they just maybe a whole day laying in the bed and have no social life, it will decrease their impact their memory too.
Yeah. The gently have the car accidents. So after injury, there's some the movement limit and sometimes the type. Yeah. So because we hit the car or something lower, they have usually they have to hit the head, right? But now this my memory is okay. But the problem that the physical the movement limit. But usually people after the car accident after effect, usually they have a problem, they memory the less. Yeah, so this is a check memory here because we hit too much the car accident, we hit the window or the body of the car, they hit. So they have usually the boxer, right? The boxer, usually they have problem the memory less because they have a hit the punch. Yeah, so many times, but they didn't damage it here. But we are, so you fighting your mom or your brother, the punch it's not right.
No.
But the boxer they have a problem. Usually they have almost 70% they have a problem with memory loss here. It's a strength of the memory. So from the injury, the outside kick, the outside the hit. And then also the mental clarity. This is the cloud. Yeah. Because how should you feel your brain today?
Say that again?
How should you feel the brain?
The
Your
brain.
mood is good or not?
Today so.
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 How about you?
So.
Your face very something happy. Maybe you got the money or the crowd here. Okay. Yeah, so we crowd or not, so energy, yes, we can do the clarity here. The energy boost here. Yeah, please close the door, please. Yeah. So energy boost here. She went outside. And the energy boost here, the caffeine, right? Yeah, sometimes we have the oversleep or sometimes we have too much work, the stress, and they want to something. They usually have the energy boost, the sugar, or the energy drink, the caffeine. Yeah, so the energy boost, yeah, sometimes we're too tired. We have the sugar, it's more happy, right? Sometimes the mood disorder and stress. Sometimes the stress, we have the spice food, right? It's more the good energy, right? So the energy boost, the sugar, and energy drink, the caffeine, or the spicy, because they want to change the mood. And also improve the focus here. Yeah, we have so many have the stress from the issue, right? The financial aid or the relationship or your health issue was too much stress. The different the stress, the mood. So we have a solution. We have a solution. We have to change the focus here. So maybe you have too much work, so you have to cut the schedule. Maybe we have to stress the circle here. I'm not give the test, right? So sometimes relationship, maybe both you're learning or both too much the order the company. Yeah, you have to follow the boss and then the good kindness or the OB or sometimes the stress too and also work together balance too. And here the good mood. Good mood here. So the smile. Because smile, we have a more comfortable with your heart and then you are more happy. Maybe not happy, not good mood, right?
Yes.
And community with the function. Okay, we have some issue. the big and the small or big something, they connect. So the contributor function, we have a small memory and then small big memory. Also small issue and the big issue. So they connect here. So I study the NLP and then the CPT, I'm practitioner. Yeah, so if some small thing, yeah, small here, they come the big. And then small, big here, small, big here, small, big here. So they have to connect. Yeah, the function. And because we have the memory short, the small short and the long short. So memory, 그냥 그 dementia, right? We have dementia, one dementia, the short memory. Now we communication the deny. And suddenly, what's your name? The short memory, right?
Yes.
And the second memory less, I don't know you. Who are you? Why are you coming here today? It's a dementia, right? The long memory issue here, and then small issue, and we talk, and the what's your name, your dinner, and the long, the who are you? Yeah, so we have the title here, the function too. Also here, yeah, sometimes we have the migraine headaches, right? We have the picture here. The front, the back head. Yeah, sometimes we have the migraine here. Well, sometimes. Or the C2 here. Or here. Yeah, we have the position, the headache or migraine, because it depends on your the issue. Usually have the headache here. Why you have the migraine here? Why? Sometimes you have a migraine, right?
Never.
Well, where position? The back side or front? The side.
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 Mostly the side.
Mostly side. Yeah, how about you? To here. Okay. The one side here. Yeah, this side here. The body. Something problem here.
Yes.
Here, they put here. And also here, they usually have a problem in the stomach area.
And then the sinus.
Yeah, true. Because the process and sometimes the brain fog, everything the brain, because the second brain here, the gut here. So if you have the migraine, or maybe you have to check your body, the belly button, the check the temperature. So maybe sometimes the pain or sometimes you have diarrhea and because cold, right?
Yes.
But sometimes you happy is more warm. So sometimes, yeah, so sometimes your mom is my grandma touched my belly button long time ago because I am in some stress something. Somebody took the money, my mom is take my money, so I'm very upset. So my grandma said, oh, okay, baby, we're here. It's more the good mood. So you did here problem, the here. Also the backside problem here, almost they have the injury or some people here, they have a problem too. Yeah, this time is my car accident. After expecting, they usually come here, the side here. Also they have a problem here. Usually they connect here on the back side here. So C7 or T1, they have a very important. They control over the body. Okay, so you're different. You are here. So what's the symptom? The migraine here, nausea,
That's right. Yeah.
and the headache. Yeah, sometimes you have the pinch. Well, sometimes the popping, the pinch, and the pain here, right? The headache, and then drum is, we want to grab something here, you swallowing hand.
Oh.
Yeah, if you want something here, the swallow here. Yeah, so very worthy here, hand. And also disease, yeah, dizziness here. Yes, because listen here, the weather. But today there is sunshine, right? But outside too much temperature with the dehydration. Yeah, we have the problem here. And the genetic predisposition, the genetic. Some people have problem the health, the migraine, the family, the disease, the history, the genetic problem here. The premenstrual syndrome is a woman, the female, the menstrual cycle, the change, or some people have the pain, right? So they have to take a pain pill. So this one, if you have the problem, this symptom, you have the ginger. The ginger tea is much better. Yeah, some people don't take the mint. Yeah, mint or green tea. They have more the core body here. So ginger tea or the chamomile the tea is much better. This one. And also the stronger physical activity. So the migraine, we have the more activity, more aerobic or gym or some stretching is much better. Yeah. And then the stress. So we have the stress. What kind of stress the body mean? So we have to check the stress, the kind and the loop. So we have the solution. Okay. And then the bright light. Yeah. So sometimes the dark brown or little dark is more very comfortable here. But too much the dark, we have depression. So we need the bright light is much better. But the problem, usually we have a problem the brown light, right? The cell phone. Yes. Yeah, too much. Yeah, bright. Too much the bright have the headache and the migraine. And usually the daily time you see the cell phone because we have outside the light and then bright is a little similar. It's okay. But the light time, maybe 2 hours is for the light. Maybe you bother your sleep. The REM cycle maybe 6 hours. So it's not good sleep. Yeah, so you have to check here. Also the alcohol. Yeah, some people we are good party last night, right? So we are maybe didn't have a boyfriend. Yeah, so we are happy. So we sharing the wine too. So usually we have one glass of wine, okay. But yesterday happy with dinner because handsome the boyfriend. So you one bottle of wine. Yeah, so I'm happy, but your body. No, it's more million, right? Yeah, so we have to balance the alcohol too. Yeah, and the treatment. Yeah, if you have migraine, what to do? Yeah, you have to listen, right? The treatment, only the medicine, right? Take the medicine. Sometimes the aspirin or Tylenol, ibuprofen, some, yeah, but only the medicine here. Yeah, 21% of the people in the past suffer from the migraine here. So little migraine level, it's okay, but over the PPT or 70, but the limit of your activity. So sometimes the migraines make a big mess in your life. So maybe migraines continue 2 weeks. 2 weeks. You have to follow the physical, the professional provider, or the check, the counselor, right? And the prevention here. Yeah, if you want the prevent the migraine and the brain fog, the prevention here, the healthy diet. Yeah, we have a healthy diet. Basically your body the constant of the water, so you have to more good the hydration, okay? Because the hydration, the enough your body and then you support your cell nutrition, the brain. Because brain to have the 70% of the water, constant of the protein too. So we need more enough the hydration, and also the balance of portion. We have the fat, the carb, and the vitamin, the mineral. So we have to balance. because we try to test the stage of the nutrition, right? So before long time ago, 1970, they have a problem, the malnutrition, because we are hungry time. So we not too much to eat the portion of the nutrition. But now, 2020, too much eat and too much over use the medication and then the chemical and the pollution. So we are malnutrition, the different type. Yeah, also drink a lot of water and then physical activity here. Yeah, too much activity have a problem the brain fog and then the migraine, right? Maybe usually 30 minutes is very good. Yeah, helps the balance. Maybe 8-hour gym, 8 hour the physically activity is no, right? Yeah, too tired, so burn out. So we have to the balance. And the walk in the fresh air. Yeah, it's very important. I'm usually it's my routine, it's my morning. I'm wake at 4 a.m. So I'm the study 1 hour, and then I go to church service early morning every day. And the 30 minutes and the routines are for work is the village here. So we have the fresh air and the 5th January where the good fresh air, yeah, we the detox your body, the CO2, yeah. But because here, very town, too much pollution, right? So we smoke or some the dioxin, so we had to avoid the street. Maybe you can go the inside of the mountain area is much better, okay? So brain fog and then migraine come together. At any age, it is important to stay in a good chair. Detect sign of the disease and early the travel, the staging. One important step is to have the regular medical checks with your doctor. So if you have some issue, your health problem, just try to 3 days. Yeah, check your lifestyle span and then your water balance, and then you check your diet, the portion or some the infection or some the food toxin and the medication you check. But we have the good sign for the body, but keep going the continuous same the vital sign and the condition the week, right? Usually the week or 2 weeks we have to go to doctor first, okay? And because some people want to try the 1 month, 2 months. Oh, I can do that. I can check the label or YouTube. Yeah, they give you solution. It's more you lose golden time to cure the disease. So they're very important here. However, you can and should monitoring your health within the checkup. You are in the best position to detect changes that your doctor should know about that. So doctors say, yeah, how long time this is symptom, then what can you drink your alcohol or tobacco, or what can you have take the supplement, the food. They have the checklist, right? So usually we keep the monitoring. So if a good solution, basically you have to check every day the blood pressure, hypertension, but you don't have the hypertension, but you check blood test, and turn later we check the body temperature here, and then we have to check the water balance, water amount. So how many days, how many time, how many amount of water we check first is okay. You have the tracker because the doctor only depend on the speech, right? Talk. So he don't know that, right? So you give the wrong or along the information, the doctor listen to your talk and then they diagnose, right? So you have to check maybe every day. You check has the track point. You give to you. You give the doctor. They okay. They figure out your routine, your lifestyle is more good diagnosis and they put the medicine. Okay. Learn to know your body and how it functions on the day-to-day the talking terms. Because here you don't know your body. Doctor, they don't know your body, right? Yeah, so sometimes it's a problem because we have to learn the body system. Yeah, usually my patient coming to my clinic first time regarding how are you today, but we figure out the documents, the chart, and we check the body. But sometimes the people they don't know. I have the sort of problem here. I have the back problem here, but they don't know the what issue and then what the balance is broken or the something the injury they don't know. So the doctor sees doctor only check up. Maybe I have stomach pain. They only check the stomach, right? But they not cover all overall is a health condition. So we have to check your body. Yeah, you have to learn it to your body by itself. Okay. Be alert to change in their pattern and then learn what signs to look for and what symptoms to report to your doctor. And you have taken the first step that will lasting the good health. In this chapter, we tell you how to monitor your health from day to day, as well as under the special the segment such a French, no French here, right? No menopause here. We also address the leading people who have the condition such as diabetes or hypertension and who may need performs more specialist tests regularly at home. So whatever your state of health, the specific information you can get about the condition that may help you guide you in your own health practice. Okay, the page 22nd. Yeah, how fit are you? Yeah, please.
Study clearly show that being physically fit increases your chance of staying healthy and living longer. How do you know whether you are fit? The most accurate measurement of fitness are carried out in an exercise physiology laboratory. But you can do some simple tests, such as the 1 mile walking test explained at right to get a general idea of your level of fitness.
Okay. We have the BMI. What's the BMI?
Body mass index.
Yeah, so you remember, right? We check the BMI, the height, the weight. So good balance is good health, right? There's some people that 180, 180, but the weight is be 40 pounds, 40 kilometers or something is a malnutrition. Or 70, over 70 is more obesity, right? So we have to check the BMI level, it's very important. Also they have the BMI they check the water amount. No matter have water or not, or they check their percentage over here. So this mean here, you walk every day 1 mile the work, so they have to check the body mass. So how many times you have the hydration or using the energy, the burn the metabolism. So we check everything here. Also the nitrous oxide the level. Nitrous oxide level is mean you walking and your gym. You have the bicycling, home bicycling or the running mat. We are using the oxygen, right? So this just the oxide, the CO2 level. So before only check the medical facility, but now you can buy the strip. So your tongue here, just maybe 10 seconds, they check the color, so you can arrange your level. The nitrous oxide is good. It's actually it's my lung and then the lung and we have the breathing. So we can check the nitrous oxide the level. It's very important. So I will use sometimes the patient, right? Patient they have to check the machine. The oxide, the nitrous oxide, they have a percentage. Yeah, 45 down. Yeah, maybe the best way. So yeah, so we have to 90. Usually 90, 90 or 100 is very good. The condition of the level, but under the 70, yeah, 60, maybe we prepare the die. Yeah, the expiry. So yeah, we very important here. Okay, keep going.
Fitness consists of three components: strength, the ability to carry, lift, push, or pull a heavy load; flexibility, the ability to bend, stretch, and twist; and endurance, the ability to maintain effort for an extended period of time. Endurance is the most important indicator of your general health because it reflects the efficiency of your heart and lungs.
Okay. Ina, yeah, eventually you have a weight is little increase. So you wanna diet. So you wanna lose weight. So we have three options. The has exercise. Yeah, three options. One, tapping body.
Tapping?
Yeah. Yeah, the belly. Okay. Vibration. And then the work. Okay. Yeah, Dina have the little overweight, maybe 4 pounds. So she's too much stress. So she want to try to all A. Yeah, so she skipped 1 month no food. Yeah, but the same thing. So she has stress. She talked to me. Oh, Dr. Choi, I'm very stressed because I'm the overweight. So because my boss is necking me, or my grandma or something that argue, and my boyfriend don't like me or some problem. So how can I do? Please give me the solution. So I give you three options. Number one, taking belly. Yeah, taking belly. Second, the vibration, the breath, the machine, right? And three, the walk in the home, the bicycle here. You're telling me, okay, I want to try number one, tapping body. No? How about second? The vibration, the bell, the machine. How about three? Walk the home bicycle here. Yeah, before the tapping body, I checked the magazine, health magazine. 30 years ago, 1980, I read the story. You have videotape, right? You have a videotape, yeah? Videotape, they want to try all the taping. So they wanted maybe 1 month. After really they lose your weight. But it's not weight, this is the muscle. Because here, you tapping here, tapping all right here, yeah, lose the muscle, no weight.
It's like the traditional corset.
Not traditional. Some people don't try. But sometimes we have injury from car accident or something problem will give us, right? Yeah, we didn't what to do. I'm broken, my arm, what to do?
You can fix it by operation or the easiest one, if not is the broken part, it still can be fixed by the what you say, the cement.
Gips,
Yeah.
Yeah, gips maybe okay. Dina have the knowledge, so she want to lose weight all body cement. No, right?
No.
It's not lose weight. This muscle. Yeah. So
Yes.
no. This one no. How about the second?
It's not working.
Yeah, vibration the best side. Yeah, 10 years ago the Koreatown have a very hot issue. Everybody wants female, everybody wants and they know how are you because vibration. Because they think maybe belly here, the peg is fun, maybe it's lose weight. But the problem, some people have side split here. Yeah, because here,
Yeah.
so some people lose weight, but problem the brain, too much problem here. Yeah, so it's not. Yeah, yeah. Here, the third to work in the home bicycle. Yeah, aerobic. Yeah, the work and then the home bicycle have aerobic. So mean you have the nitrous oxide cycle here. So we work here with the fresh air and then we come the short right. So we have to cycle the aerobic cycle here. This number 3 is the solution. Number 1, number 2. Okay. Yeah, they have the loose muscle tissue. The second, the brain, yeah, too much brain. Baby, right? Baby, too much. Oh, I like a baby. Love baby. So here,
Yeah.
no good, right?
No good.
Yeah, maybe 70 female have dementia. Too much violation is no good here. Yeah, also in the belly button, belly here, the vibration, no good. You sometimes have a problem too here. Yeah. Hereditary problem or some issue. Yeah. The number is much better. Okay? Keep going.
Evaluating your fitness. No single measurement of performance classifies you as fit or unfit. Just seeing how well you do at everyday activities will give you some idea. If you become breathless after climbing a flight of stairs or hurrying to catch a bus, you clearly would benefit from some conditioning. Check with your doctor before you start an exercise program.
Yeah. Usually my patient coming, it's my clinic. After the treatment, I give the homework. The homework, the PTs, the program. So, Dina, you have a problem, the leg, and then third problem. So, I give to you, Dina, okay, I give it to you homework. You every day, every morning, every night, your 2 units, your 3 times, left side, right side, the tongue, the leg, and then up your shoulder is down, here the stretching. So it's a unit, and then give it to your number, right? But maybe I'm not give the detail. Dina, I give you homework. You have to turn the leg and then shoulder up down. But you remember, okay, the Dr. David talked to me. I had to do things on homework side, but he doesn't mention about number, right? Time. So 24 hours maybe you turn on the leg and then up and down your shoulder is no good, right? So the professional doctor, they have to give it to number and the unit. Okay, so the personal trainer, yeah, some people, some the gym that they give to the performance or the stretching or some the exercise, they give to the detail number of the unit. Yeah, you saw maybe turn around the 5 times every morning, and then the night time 2 times. So we give detail number. So very important. So maybe no give the number and the nutrition. Maybe 24 hour turning line is more damage, right? Yeah. So we get to the performance, and you have the measurement and the homework, the fitness, the program, the number here. Okay, keep going.
Do the 1 mile walking test.
Yes.
Okay. Preparing for the test, complete the physical activity readiness questionnaire on the right. If you answer yes to any question, talk to your doctor before taking the test. Also check the list of medication below right. If you're taking any dose listed, The test is not valid for you. Use a stopwatch or a watch to with a second hand to time yourself and measure your pulse rate after the test. You will want to record your time and pulse rate. You need these figures to determine your fitness level.
Okay. Yeah, you will want to record your time and then first task, like two. That as the diabetic patient, you have to check the blood sugar level, and the hypertension people is check the blood level. But you have the memory. Remember, you have to check the time. Yeah, every morning blood sugar, blood sugar test level before empty stomach and after eat 2 hours, right? So your daily routine, you have to check date and the time. It's a regular time. But sometimes, we have a stress. So you usually retain the hypertension, the blood pressure level, check the early morning and afternoon, right? But you're angry. Oh my God, it's my blood pressure level is high, so we have to go doctor. I have the hypertension, right? No, right? Also the blood sugar level too. So we have to keep the routine, right? Test the time. You enter stomach and then after 2 hours, right? So there are some people have stress. Stress because they have to change the time and change the mood. Maybe it's routine is normal. Normally we have the routine, the wake up and then I check this number, the record here. But sometimes you're driving. And some people are jam in traffic and then somebody question here, I'm not happy. So maybe person high, right? So after check, it didn't high because write down the syndrome. So your home is a very peaceful mind and then you're happy and then you want to come to Saturday class. It's not happy, right? You want to oversleep, you want to lazy your home, the cozy your home, but you're driving here. So you come here today, my class, maybe your blood pressure level is 120 to 80. But the doctor say, Dr. Choi, okay, dinner today we have class, we will test the hypertension. And you check 130 and 90, right? Yeah, this will write down the syndrome. So some people, the patient, the monitoring and then the check is regular, but the write down syndrome, don't strictly once or the clinic, maybe they check the write down is more high level. Yeah. So doctor maybe check the loss or check the prevented the purpose level up, they give some of the medicine something, right? So just event, right? Non-regular. So you have to maybe you have the tracker, your record time, usually your average, right? So maybe week, maybe 20 days, 2 times is okay. Over +5 or minus is okay, but 20 over, we have some issue, right? But you have to check memory is much better, the detail. So we have to prevent the medical action, right? The medication too. Okay, keep going.
Wear a comfortable pair of shoes. A flat water, mild track, or an indoor track is best setting for the test. If you do not live near a track, use your car to measure distance of 1 mile on a flat road that has a little traffic. If you are walking outside, do not take the test when weather conditions are extremely cold, wet, or windy.
Yeah, so here, right? You have the brain fog and then migraine here. We have sometime you have a headache, right? Because the sunshine, the weather is good, it's okay, but the cloud or the rain is by the chilly and it doesn't matter the test. Yeah, so the test monitoring is a good condition. Yeah, so maybe the home, the inside, so maybe home cycling or stretching is okay, but outside, it's hot summertime, 100 degree, maybe you learning, test, no, right? So really very important here, okay?
Do not eat for 2 hours and do not smoke or drink caffeinated beverage for 3 hours before the test.
Okay, here, usually the patient call me the appointment. Okay, Gina wants the appointment to my clinic, so she called me today. So today I have too much traffic, so please come tomorrow. So I had to check the nutrition status, and then we had to check the kiddos the street, and then with the pH level. Yeah, please end this tomorrow 2 hours. Okay, so you have 10 o'clock, 10 a.m. your appointment time. At least 2 hours before we have the breakfast, and do not eat anything. Okay, because we have to detail. Yeah, so we have the blood sugar level or the blood pressure or some kind of the issue. So, and then also usually the blood test, right? Blood test before maybe last supper, right? So at least 10 hours or 8 hours with dentist tomorrow with the detailed check, right? It's all very important here. Yeah, okay. And then also the before the test, maybe water. Yeah, maybe 6 ounces, maybe 6 ounces or 20 ounces of water is much better. Okay. Yeah, keep going.
Spend at least 5 minutes warming up before the test. Do some stretching exercise and walk slowly.
Yeah, this will prevent the injury. Yeah, if you wanna play the tennis or basketball or you are a badminton player, you have to prevent the injury. You have to warming up. Yeah, so I taught the first time the semester, right? If you wanna good health, every morning the good wake, the morning, you have to hit the pit. Because the pit, you remember why the pit hit?
To wake up the brain.
Yeah, the wake up brain, and then the muscle of movement is warming up, and then we warming up your temperature, right? So we not injury. But so we have the tennis or badminton, you're not warming up the movement or no exercise, right? Yeah, it's injury. So we have to check the stretching or at least 5 minutes or 10 minutes. Yeah, we have to the warming up. Okay, your muscle, the joint, and everything. Okay. Keep going.
Spend at least 5 minutes warming up before the test. Do some stretching exercise and walk slowly. It is normal to perspire and breathe heavily during any exercise session. It is also normal for your heart to beat faster during exercise. However, if you experience any of the following symptoms, stop exercising and seek medical attention promptly. Persistent pain or pressure in your chest, shoulder, arm, neck or jaw. Nausea or dizziness. Skip heartbeats.
Okay. Yeah, so you have to check your everything, then your sports injury, the prevention, the program or testing or everything. So we have a checklist here, the very important here. Yeah, physical activity, release the questionnaire. Okay. Has your doctor ever told you that you have the heart trouble? Yes, no. Yeah, this we have on maybe 10 kind of the questionnaire. Yeah, if you have time, you check it by yourself, okay? And the medication. Yeah, medication it's not your part. So you can handling your by yourself. It's from the doctor direction, okay? And taking the test. Yeah, test here. Yeah, number 5. Number 5 here. Now assess the current fitness level by consulting and then the chart on the page 24. Usually you check the first and then the Chinese medicine. you check the first, what kind of health issue, or problem, but usually the parts, the 1 minute to 120 or 140 pound is much better. Too low, you have some asthma, too long, maybe you have you check your hypertension. Okay, so this is 22nd page and then 23rd page here. Usually the monitoring the solution, and then 24 pages here. Yeah, pass to 24 here. How did you support? Yeah, this one is not easy. This one, but just the skip here. Okay, the 31 page here. Awesome. That's something. The kidney section here. 31 page here. The kidney here. The ureter, the bladder, urethra here, the nephron. Usually kidney is nephron the level, very important. Dina, what's nephron level? Last week we learned nephron level.
What method?
Yeah, nephron. The kidney, I realize this, they have a problem, your nephron level is too low. You have to be careful with kalium and the potassium and the vegetable. Yeah, the vegetable, the suck the water, right? The too much kalium and the potassium to come out. So maybe the kidney position low people, they have the be careful the cooking man, right? Yeah, so too much the banana or too much the watermelon or the water is no good. Yeah. Also the small intestine here, the small intestine function have the association with the nutrition. In the large intestine, they had to put the water out, right? So water and then they put it out. So with the small intestine is very important here because we send the cell the nutrition and then we did something eat for outside, they coming through the stomach area and the small intestine, they send it to the liver and then they make energy for the metabolism. Okay. Also skin too. The skin cover all the organ and then have the protect outside the bacteria or injury and some of the issue. Okay. The pit here, yeah, sometimes you have the disc problem or the sciatica problem, they usually problem the pit, no balance. So one side is a little, 1 centimeter more long, more short, and then you twist. Yeah, usually female have the delivery of a baby, they little change the shape, the hip. So we see it, so the pit is maybe sometimes front here, its body is more normal condition, maybe backside here, usually have back problem here. So we have to check very important the pit here. Okay, 32 pages here. Now, how is your vision? Yeah, I explained to last semester, we connect eye over here. So sometimes we have the little dry and the letter eye, you have to check the here. You check here, the backside here. Yeah, you have a spine here. You check here. Maybe little tight. They connect to the eye. So if you have a problem here, the eye little dry, too much the computer or too much the dry. Yeah, like here. To the wine bottle. Yeah, 2 wine bottle, and the bottom, the taping, and then cover the towel, and then this is here, yeah, turn around the wine bottle here, and then up, down, so we have more preservation, and then eye level here, Okay, the more touchy here, it's more bright. It's much better. Okay. Yeah, so some people the eye supplement. So just one bottle will take all the supplement. Eyes bright? No. Just the support cell. Yeah. So it's not the level is different. Yeah, different issue. So you have to check this one, or you have to check the eye shop or the eye doctor. You can see more. Check your lenses some or could change the glass too. Yeah, sometimes the glass is not suitable for your eye. The cloud or magnet too, right? Yeah, so you have to check first. Okay, keep going. How's your vision? Your vision can change in the several way.
The most common problem involves errors or refraction. The mechanism by which an image is focused on the retina. This error affects your visual acuity, the sharpness of your vision. Corrective lenses can almost always resolve the blurriness caused by a refractive error. Other types of defective vision may be the result of disorder of the eye or optic nerve or of the nerve pathways to the brain. This vision disorder may cause altered visual acuity or interference with your field of vision. Corrective lens will not eliminate this problem. If you notice any persistent change in the quality of your vision, report it promptly to your doctor. Further medical evaluation is needed.
Do you have take the eye drop? Eye drop? Or when? Usually when you're using the eye drop?
This right.
That's right. Okay. The medically you can buy the first the OTC, right? Eye drop. But we have Chinese medicine. Everyone the cover, right? They make it water or salty water that they using the instead of the eye drop. Yeah, sometimes because we have two kind eye drop. You can buy the OTC eye drop. Sometimes you have dry, it's more. It's good, right? But how many times you use daily? Each hour or sometime? Sometime. So how's it feel? It's good?
Better.
Better?
Yeah.
Yeah, but after using the eye drop, you can go open the more restroom, right? Restroom. You don't know? Yeah. Yeah, because eye drop, they have the water pill here, the same thing. It's more increase the pee. Yeah. So if you're home, your natural salt, right? No chemical salt. Very pinch of the salt, the water, they cleanse much better. And then also the hot towel, the hot water, and then the cut the temperature and then massage here, it's much better. And also you touch the ball here, it's more better. So eye drop, too much eye drop, it's no good. Okay, keep going.
Focusing problem. Problem of focusing refractive error usually occur either because of defect present at birth or because of the natural aging process. Some people are born with nearsightedness, the inability to focus at a long distance, farsightedness, the ability to focus at a short distance, and or astigmatism, and even curvature of the transparent front portion of the eye, the cornea, which distort vision.
Okay. Yeah, in my case, when we take out the glass, it's much better. But take out the lens glass, Dina is more beautiful. But here is my book, the cloud here. Because of my lens, the focus the driving. The driving or the light time, the driving we see focus here. Usually I will take out my glass, the study or computer. So sometimes the focus and the focus problem, you can see the eye doctor, they suggestion to you guys what you using for your class, reading class or you wanna driving. So I choose driving, but I'm almost 1 month now, but I'm not used to my class. Yeah, sometimes this one. Yeah, so it's not clear, but it's more. You guys are more beautiful. Is that? Yeah. Okay, keep going.
Problem of accommodation, your eyes' automatic ability to focus on near object develop with age. This type of defect is usually helped by wearing bifocal lens.
Mhm.
Check your vision. Check your vision by answering the question below. Check each eye separately, covering the other eyes completely. If any answer indicate that you have problem with vision, discuss them with your doctor. Many problems can be corrected with glasses or contact lenses. However, if you have an eye disease, prompt treatment is vital.
So my church member, he's age 22. He have the contact lens. Yeah, every Sunday he brings the little package inside for they have to keep the sanitizing and then the contact lens. He forgot one side. So one side here, lens is a regular. So he want to try is the screen scan crowd. Yeah, because the one side the contact lens and then normal light. So cloud here. Yeah, so he have to buy the first lens so many times, but too much of a pearl, right? So he want to try last surgery. Yeah, she 2 months ago he have the surgery. The last, she's much better. Yeah, but the young generation and then Chilean people, one case maybe 2 times take the LASIK, but it's more less the focus of the eye, the condition. So you have to keep the eye health. You have to support your immune system, and then you have to more focus on them using the supplement. Okay, it's much better. So sometimes LASIK is very good. So sometimes it's more that's more the focus. To keep going.
When you look at an object in a distance, such as street sign, do they appear blurred? If so, you may need correction for your nearsightedness. Can you read very small print at 16 inches? If not, you may need reading glasses or contact lenses to correct farsightedness.
Okay. Also, if the sinus, why the eye in the vision and the sinus, they will close here, right? The sinus people have the background and then they limit of the focus of the eye. So usually the sinus have a problem. You have the solution first, and the test over the eye doctor is much better. And because I have the cat is my home. Yeah, but sometimes I'm very happy, but sometimes the too much bother is my sinus. I almost I cure my sinus, but sometimes so it's my health air before the cat came to my home is more better, but I never put right. The cat coming to my house, I didn't bother. It's the condition. Yeah, so because we have the cycling and then the home air is much better. Filtering is very important here. Okay, page over 34. Yeah, this of the eye. Yeah, so you can see here you have this of eye. You have a time. You can read it here. Okay, and also 35 page here. Professional the vision checkup. you have to depend on your either. Yeah. The page 36. How is your hearing? You have a hearing problem? Anybody? Your hearing the condition is okay? Are you okay? Everybody okay? How about you, Dina? Okay. Yeah, we are church member, hearing problem. She had the infection a long time ago. And 3 years ago, this side, the other side, have a problem too. Okay? The childhood is a bacterial problem here. It is shock. Because husband, the car accident in the front of her. Because every morning, together, open the store. The wife will drop, and then open the store, and the car, the pass away. So she stopped, and they come in the hearing problem too. Yeah, she's very beautiful. Now 65 opinion. The problem, she can hear not much easy. It's more angry because the more she can hearing the voice. It's more noisy. Okay, Dina, maybe it's a good person, has a good person. Dina, are you okay? But she hearing problem. Dina, are you okay? Because she only try to the voice up, but she normally she can measure the voice the tone. But John, Dr. David is very angry. I just communicate regularly the communication, but she thinks I'm very angry. Yeah, so you can check around your boss, maybe hearing problem. Yeah, you can check grandma or some people, usually senior people have more voice tone over because they have a problem with hearing. Yeah, some people hearing the AD, right? Yeah, sometimes my patient come in, my clinics, I'm the treatment time, she have the hearing aid. Yeah, she have a heavy crowd or something. I want to do something here, to catch something. Yeah, catch something. So, but she take up, she can't hear anything. Yeah, so you have a hearing issue. So what's going on? Okay, Dina, try to lead.
You can experience two general categories of hearing loss. Conductive loss is the result of faulty conduction of sound from the outside to the inner ear via the eardrum and the ossicles, the tiny bones of the middle ear. The other type of hearing loss, sensorineural loss, is caused by a failure of the eighth cranial nerve, the nerve of hearing, or of the cochlea. The cochlea comfort the mechanical vibration of the eardrum and ossicle to neural impulses. Sensorineural hearing loss is usually not reversible. However, it can almost always be helped by use of a hearing aid, which increases the volume of the sound entering the ear. Sensorineural hearing loss usually affect detection of the higher tones that from hissing sound.
Okay. Yeah, you understand, right?
Mm-hmm.
Yeah, I explained to you. Mm-hmm. And then tinnitus. Yeah. Yeah, sometimes too much the stress. Yeah, too much stress because we have to overwork and too much thing. So sometimes the tinnitus is coming, right? The many other, right? Many other diseases, maybe your room is around here, and then tinnitus is here. The base of the Chinese medicine, the ear, the connected to the kidney function. Yeah. So the kidney function is low, have two signs: the ear, the problem, in the ear tinnitus, and the back pain. Yeah. So your medically your eye or ear, no infection, no anything. Yeah, everything's good, your condition. But sometimes things come in, you check the kidney condition is low. Because we have the cell phone, right? Maybe you see the just levelly we maybe the using the cell phone maybe 8 hours the battery, right? But I using the YouTube maybe 3 hours, 4 hours. It's battery, right? The same thing. You're too much overwork and too much stress. Yeah, they will come in with the low the condition. Okay. Yeah, keep going.
It may make it difficult to understand speech. Many of us experience a degree of sensorineural hearing loss as we get older. However, this loss can be made worse by exposure to loud noise. Sensorineural hearing loss may also be caused by some poisons or drugs. High doses of aspirin or some diuretics may cause a temporary hearing loss. Certain antibiotics and at least one anti-cancer drug may cause permanent hearing loss. If you think you may have a sensorineural hearing loss, do not hesitate to consult your doctor. Conductive hearing loss may be caused by wax or cerumen in the ear canal or by fluids in the normally air-filled middle ear.
Okay. Sometimes you have the music, the listening time, right? We have an earphone and a headphone. Yeah. What kind of your choice?
I use loudspeaker.
Loudspeaker?
I don't like to stop something in my ear.
Okay. John, sometimes you have the music time, so you want an earphone and a headphone. So what to do? Sometimes you have a speaker, right? But night time, midnight, you want to listen the music. So you are using the earphone or the headphone?
I just use the speaker.
The speaker?
No.
Yeah. Yeah, if you want to type earphone and headphone is much better. Well, earphone here, yeah, earphone is more, they sensitive here, it's more the problem, the hearing problem here. The headphone here, the only the focus here, right, is much better. The earphone and the voice, something the communication was noisy and then inside the electrically the voice here, they are more damaging, okay? It's a more speakers much better, but midnight maybe somebody complain, yeah. So headphone is much better.
Going to the club.
Yeah. Also, we have the swimming pool. You want to swimming here? Yeah, maybe water is coming here inside here. Maybe infection, some problem. So you have maybe the cover here, right? So you little more, okay?
And sometimes using the cotton tip to
Yeah,
clean
cotton,
your
yeah, it's
ear
much
is
better,
causing
yeah.
infection.
And then sometimes the outside gardener, they will do the water or something too much the work, and you can see right the headphone here because the noise is very typical here the problem too. So if you want something, yeah, your headphone is much better. Okay, yeah, 37 page here. Could you the benefit from our hearing aid? Yeah, your age now, so you don't need this one, right? Yeah. So if you have a chance, yeah, you're needing this one by itself. Okay, 38 pages here. Yeah, 38, it says monitoring your oral health. Yeah, I'm gonna focus the last week this oral test because denture or tea and then we have a toothpaste. So I'm gonna give it to you with the product, the information, and then I give more the material for you, okay? Because the oral problem, yeah, we have the eye, ear, but the oral is very important here. Because the oral means the outside come everything we start here, we are immune system, right? Yeah, so water or food or ocean, everything here, but not the oxygen, air. Yeah, because air, the pollution will come in directly come here. So we clean the loads here. They have a filtering, so they change the air temperature and then air pollution. The cover, right? The mouse on not filtering everything. So sometimes if you stand the problem, they have the bacteria, the virus come the tongue in the inside the odor, and also your tongue. You can see the diagnosis of what's problem, the organ problem. You can see it's very important here. And then also you have to check the taste, right? So if you have the problem, your health issue, maybe tongue is a little sensitive is low. So you can change the taste. Because my mom is very good cook long time ago, but now she have now hypertension, little cholesterol, and so she have changed. She had to change the taste. So she never cooked the salty, but she have now the salty because she have to take the hypertension medicine. So it's very important. So we have to check the sense of your taste and then the nature of your health issue by the tongue, the diagnosis. So that's great. I want to give you the copy for the material. So how can you figure out your health condition and by the order? Okay.